Roland. And I didn't stop you, but I should remind everybody, 5 minutes if you can. And next is Ms. Thomas.
Thank you for the opportunity to be here. I appreciate also the opportunity to speak on behalf of ADAPT, a national grassroots disability rights organization. Many of ADAPT's members have done time in nursing homes and other institutions, basically becoming a cash crop for an industry that wants to draw down dollars. Living in an 8 foot by 8 foot room with a stranger, being told when to get up, when to go to bed, what and when to eat. Basically, your life is not your own. I've been told many times I would rather die than go back. I've never in my life heard someone say, I'm looking forward to moving into a nursing home. Those who got out did not get better from their disabilities. They got out. And that's simply it. And they now live in the community with attendant services. They had to fight their way to get out, for the most part, to live in the community. We know of children born with disabilities who have been forced away from their families into institutional placements. Children belong in families, not in institutions. Being institutionalized by one's own choice is one thing, but being trapped there because you have no alternatives is something very different. According to CMS's own numbers, nationally over 300,000 people in nursing homes alone have expressed a preference for home and community-based services, yet they are stuck inside. They do not even count those trapped in other institutions and those in the community scraping by as they wait year after year to move up on a waiting list. I urge you to take action. Words are great, and what you said today was wonderful to hear, but we need action. Pass H.R. 1621, the Community Choice Act. Squarely address the institutional bias in long-term care. Medicaid has helped millions of people with disabilities of all ages to achieve independence, dignity, and health. But awareness and values of our nations are changing. And as medical breakthroughs promise more independence, the glaring problem of the institutional bias grows more pronounced. Even money follows the person. A wonderful and important new demonstration program funded in the DRA requires that people have to be in an institution to get out and receive services. You should not have to go in to get out, but nor should you be stuck inside because people want a better solution. Our current system is backwards. Services are fragmented and based on disease categories and age instead of on functional need. The institutional bias had led to a system wherein institutional services are mandated and the community is optional, where 63% of the Medicaid long-term care funds go to institutions and just 37% are left for community services, all the community services, despite the facts of long waiting lists, sometimes as long as 10 years. Ironically, the same community services cost only about 2/3 of their institutional equivalent on average. We hear about the fear of the woodwork effect. This is an insulting term that actually refers to the unmet need of real live human beings. We are not cockroaches, and this is not pest control. Forcing people to live and get by on nothing is neither good policy nor does it solve the money issue in the long run. Many states would like to even the playing field, but the federal entitlement to nursing homes alone stops them. The Community Choice Act would help to improve the services in nursing homes and other institutions as it would give them real competition. Over 700 organizations from across this nation have signed on supporting the Community Choice Act. Over 700. The bill is based on a simple concept. It allows individuals eligible for services in a nursing facility, ICFMR or IMD, the opportunity to choose instead a new alternative. Community-based attendant services and supports. CCA makes an existing mandated service more flexible to meet the needs of those who are currently eligible for its services. You could even use these services in schools. It doesn't force anyone to move out, nor does it close any facilities, as some have claimed. It simply gives people a choice. In addition, the Community Choice Act assists states to reform their long-term services and supports. Women, take heed. The vast majority of people in nursing homes, over 70%, are women. The vast majority of the underpaid direct care workers are women, over 70%. And the vast majority of those who provide free care are women. Is this issue swept under the rug completely because of this? I don't know.
But I do know is that most of you, in men and women alike, will have to face this issue in the near future. I faced it when my father-in-law came to live with my husband and me, a diabetic who had a stroke. He stubbed his toe, and in the end, he had to have both of his legs amputated. His eyesight was going, and so was his memory of things like whether the stove was left on. Professionals urged us to put him in a nursing home, but he lived with us with attendant services. But today, he would be at the bottom of an over 40,000 person waiting list. He wouldn't have reached the top before he passed away. As America grows, this issue grows larger and larger. It is not a question of if we will be dealing with long-term care. It is a question of how we will be dealing with it. Like most monsters under the bed, once we confront it, we will find that it is not what we feared. One more thing. Even as CMS encourages the states to assist people who want out of nursing homes or other institutions to move out, a great thing, it has bizarrely decided to cut case management services by almost 70%. This assistance is vital. This devastating cut shows the lack of understanding and the reality of people's lives. And it distorts priorities. You need to reverse this terrible decision on case management and reverse the overall institutional bias in Medicaid. Passing the Community Choice Act is an important piece in this overall effort, so please pass it. Thank you for the opportunity to speak today.
Thank you, Ms. Thomas.